Alles beginnt mit einer Frage, mit dem Wunsch, ein Pferd wirklich zu verstehen. Aus genau diesen Gedanken ist der PKN-Podcast entstanden. Ein Podcast für alle, die Verantwortung übernehmen und bereit sind, genauer hinzuschauen. Hier kommen Tierärzte, Spezialisten, Pferdebesitzer zusammen, auf Augenhöhe. Geleitet von wissenschaftlicher Expertise, getragen von Neugier und Respekt vor dem Pferd. Mit jeder Episode öffnen wir die Türen der Klinik ein Stück weiter. Wir teilen Wissen aus Forschung und Praxis und machen Pferdemedizin verständlich, relevant und lebendig. Das ist der PKN Podcast. Schön, dass du hier bist. Learn more to care better. This week, we have a slightly different episode. We're stepping into the world of advanced equine colic surgery training, where experienced surgeons mentor the next generation through highly specialized procedures. In this episode, we explore why practical education is essential, how confidence is built in the operating theater, and what it means to continuously raise the standard of care. Because better training ultimately means better outcomes for our horses. We hope you enjoy this episode. Happy listening.
So, welcome back to the PKN podcast. Today's episode takes you behind the scenes of something many horse owners hear about but rarely truly understand: advanced colic surgery training. What happens when experienced surgeons from different countries come together, and why does it matter for your horse? In February, we hosted a 3-day practical equine colic surgery course here at the clinic. The course was co-organized by our good friends and great surgeons Professor Gessica Giusto and Professor Marco Gandini, as well as our own head surgeon Dr. Nico Bolz. So before we dive in, could you tell our listeners a little bit about who you are and what are you doing every day?
Of course, and thank you for having us. We are equine surgeons working in referral hospitals and academic settings. A large part of our daily works involves emergency medicine, especially in colic surgery and the intensive care of critical ill horses. Alongside clinical work, we are deeply involved in teaching and research, always with the goal improving outcomes for horses.
One thing we often say here at PKN Podcast is that progress comes from sharing knowledge. And that's exactly what inspired this course, right, Marco?
Oh, yes, you're absolutely right. Until now, there has really only been one comparable colic course
In the States.
Just in the States, yeah,
Yes.
in Florida. And that makes it a little bit difficult for all European surgery to attend sometimes. So the idea was to create a European space where we can group together experienced surgeons and they could so each learn from each other's experience. So it was more on sharing experiences because it's not colic surgery is not just about technical skills but also about decision making, timing, and teamwork, of course. From the very beginning, your team here for the clinic, Netherlands, supported the vision. Nico Bolz helped to shape a course, teaches as a lecturer and instructor, and you, Christian, supported the project with facilities, time, and actually excellent ideas.
So, as you mentioned already before, the course, the only course until now was in the States. So we have also limited spaces available for participants, not only geographical issues. And as the horse population is rising also in Europe, I guess it is a good idea. What made the course different from the others, or from the other and not from the others? I heard that you had a human surgeon coming here to give some lectures also.
Yes, the level of participant was truly remarkable. We had diplomates and very expert clinicians from many different countries, but beyond that, it was the atmosphere. It's extremely interactive, with honest discussions and shared clinical experiences. And it wasn't just teaching, it was learning together. It's what make an amazing course.
Cool. For horse owners listening, it might be surprising to hear how much practical training surgeons continue to do. Why is it so essential?
Well, surgery cannot be learned by lectures alone. And so hands-on wet labs allow surgeons to practice techniques, make mistakes safely, in a safe way, and receive immediate feedback. That's what builds precision and at the end makes surgery safer for the horse we treat.
So, like fire workers train how to resolve fire issues, for example, or special forces always keep on training. I mean, I like this approach a lot. It has to be that you are not in the situation to be harmful for the patient because you are aware of the technique already before.
Yeah, there are so many professions where this is just a routine thing for professionals. Let's think about pilot. They test on simulators, firework.
And they consistently do this next to flying.
Even very experienced ones. So that's important.
So when horse owners think about colic surgery, they often imagine the operation itself as the hardest part. But in reality, the challenges start much earlier, don't they?
Exactly. The biggest challenges are early diagnosis, rapid decision making, managing systemic complication, and provide intensive postoperative care. And even small improvements in these areas can make a huge difference in survival.
So we have some things that stand out in Netherlands. One is international spirit. Why is cooperation and collaboration across countries so important in equine medicine?
Well, the most important thing to note is that there is no clinic that sees every type of case. So by sharing our experience internationally, we refine protocols, learn different approaches, and altogether improve patient care. So collaboration, we think, pushes the entire field forward and at the end benefits horses and their owners.
Okay, good. So understandable. How is it to work here in Netherlands for this kind of approach, Jessica?
It was fantastic, Christian. The facilities are excellent, the organization was flawless, and the team created a welcoming but highly professional atmosphere. So everyone supported the project, and it's truly an ideal environment for advanced surgical training.
Okay, thanks for this. We try to improve any time, like we had a meeting already today in the morning to catch up the things that we learned from our meeting. Let's look ahead. What will surgical training look like in the future?
Well, we expect certainly more simulation, so to practice more on simulated structures, more structured skill assessment, and again, I'm sorry to emphasize this, but will be stronger international collaboration that would make the difference. So training will hopefully become more standardized and evidence-based. And again, this will help surgeons to improve the outcome for their patients.
I mean, it is very easy. The equine world anyway is international, but we're increasing the numbers of cases by going international. It is as easy as it is. And you learn more from each other, because from an orthopedic approach, for example, you see different kind of mindsets related to the offspring of the country where the people are working or are coming from, and so I think it is just an objective logic reflection to do this. For the professionals listening, what message would you like to share?
Never stop learning is the first important message. Even where expert surgeons benefit from continuous training and discussion and collaboration. That's how our field evolves continuously.
Anything especially in the medical related world is benefiting from this, I guess. And now a message for our horse owners, because at the end of the day, everything what we are do here is helping to care better.
Yeah. Well, if I have to give an advice to horse owner, and also what come out from this course, actually just a note. All together, we put together 18 participants coming from all over Europe, and as you said, that makes a huge caseload. Actually, we had we had the experience of more than approximately 4,000 cases treated by all these surgeons. So we grouped that, and so at the end, the main important message is to act quickly, to understand if your horse is colic, starting feeling pain, that would be the time to call your vet and to rely on your vet at home for their decision, and that will improve so much the outcome, and ultimately that will make your horse to feel less pain altogether, and that's the most important.
And maybe you, by acting fast and quickly, maybe you can prevent the surgery.
Yes, absolutely. Yeah. We as a surgeon, we are looking into many preventive methods to prevent surgery.
So, and third and last, and but not least, what would be your message for referring veterinarians?
Timing and communication are key. You don't need a perfect diagnosis before referral. Recognizing when a case might become surgical and acting early improves stabilization, reduces intestinal damage, and increases survival. And when field vets and referral team work together, outcomes improve dramatically.
Thank you. Thank you for this. I guess it was a short insight and maybe a wrap up for our course, for your course, not for your course with Nico. And I'm always pleased to welcome you, because it is also for me very interesting, and it is a nice improvement. Also from other aspects in medicine, to see how that approach changed within the last 1 or 2 decades. I mean, some years in Netherlands, this year 20 years, and when I see a regular surgical colic course average case, the horses are looking so much better than in the past, so immediately after the surgery, and an average, not a very complicated case, an average case is leaving the clinic within a few days after the surgery. This is enormous from the development that you are doing. So thank you for this. Thank you for all this, what the other international and national colleagues are doing for this kind of patient owner and horses in particular. And thanks for the exchange.
All right. Thank you very much for hosting us.
Thank you.
Danke, dass du dir heute Zeit genommen hast, bei unserem PKN-Podcast dabei zu sein. Wenn dir die Folge gefallen hat und du unsere Arbeit in Zukunft unterstützen möchtest, würden wir uns riesig freuen, wenn du uns auf deiner Lieblings-Streaming-Plattform oder bei YouTube abonnierst, likest, hypst, kommentierst oder Fragen stellst. Damit können wir sicherstellen, dass du zukünftig keine Inhalte verpasst und du hilfst uns und wir erreichen auch noch mehr pferdebegeisterte Menschen in Zukunft. Vielen Dank dafür und bis bald.